Good afternoon to everybody. I'm so glad you're here. I also want you to understand that this is an open question. If you have a question on anything, raise your hand. We can stop anywhere. I've been doing diabetic lectures now for years, and I found that the PowerPoint and the slides and everything that I've done, this is the best way to do it. Just an open lecture that involves you. Because this is all about you. And I imagine quite a few people in here probably are struggling with diabetes. So I want to engage you, meaning I want you to raise your hand, answer questions, and we will stop wherever we're at. I have been a clinical nutritionist before I ever got involved with medicine. I was actually a registered dietitian at one time. I did diabetes at Emory University. And yes, I am a Yankee. I'm originally from Michigan. Yeah, and go state. And then I came down to Atlanta and saw how beautiful it was in the winter, meaning I could actually see the ground, and decided I would never live there again. Another thing I've found since being down in the South, back in the 80s and 70s when I came first down to Atlanta, I noticed that there was a huge amount of diabetes. And there is a huge epidemic of diabetes in the South for years. It is one of the most common diseases in our country. There's no doubt about it. It's an epidemic and it's rising every year for one reason and one reason only. Obesity, weight gain, and central, mostly around here. So if you're carrying extra pounds here, even 15 or 20, you're at an increased risk for diabetes. Yeah, everybody, go ahead and eat your pie. Anyway, we have gone from, in the 80s, the number of Americans with diabetes in the 80s was 6 million. We're now at least 20 million, and they think that there's probably 40 to 60 million actual diabetics. And I'm going to talk to you a little bit about what we call pre-diabetes. The one news is, and I follow the statistics on diabetes through Pickens County, which, you know, we kind of fight with Mississippi for being the worst health back and forth. Well, we are not the biggest diabetics around. We are not number one anymore. We are not way off the Richter scale as being, wow, Pickens County. Now we're kind of like the national average, believe it or not. And it's not because we've done better, and it's not because we lost weight. It's because everybody else has gotten heavier. The country as a whole is catching up with the obesity factor. And our children and grandchildren, and I'm sure all of you have some that you wish they wouldn't eat the Pop-Tart and you could eat brand cereal, are doing this. And in all the years I've worked, even with diabetes, we never ever diagnosed anybody. In fact, it was a clinical question. If anyone was 40 or less, they were not type 2 diabetes. Remember those days? You had to be an older person to have type 2 diabetes. Today, we see 12-year-olds with it, purely for the fact of obesity and inactivity. Let me tell you what type 1 is, because I'm not talking about type 1 diabetes. Type 1 or juvenile diabetes is someone whose pancreas does not make enough insulin. They do not take pills, they take shots. They're on the pump. I'm not talking about those. That's the rarest of the diabetes. The most common one is type 2, okay? Adult onset, you know, the kind that when we gain weight, we have to start off with pills, and then those don't work, then we start taking shots. Well, there's a new diabetes. Some people call it type 1, type 2. Some people call it pre-diabetes. There's another one. And what we're finding now is most diabetics, like a lot of you in this room probably say, I'm not a diabetic. My sugars are fine when I go for my fasting lab. That's true. But guess what? You may very well be a diabetic, a pre-diabetic. Most diabetes that's type 2 diabetes is not diagnosed for 10 years after you clinically are a diabetic. And the reason is that when you go to your doctor for your labs, we're fasting, right? That's when the lowest blood sugar is. You haven't eaten all night, of course your sugar's going to be low. That's what we want. Diabetes is gone. You know, you don't have it. Check your blood sugar after you eat that pie today. Check your blood sugar on your friend's machine about an hour or two after you eat your pie, your meal today, and see where your sugar, see if it is 100, 110. If it's high, you need to talk to your doctor. When you go talk to your doctor, tell them my postprandial, or after I ate was high. And they should do a test called a glucose tolerance test. They should send you to the hospital where they give you something to drink. How many people remember that when you were pregnant? You drank that stuff to see if you were a gestational diabetic? Does anybody remember that? That's the same test. They'll have you drink something and see if your sugar goes up and then comes back down to normal. Guess what? You just caught diabetes early. That's when we want to catch it. We want to catch your diabetes early because that's the way we prevent. Number one cause of blindness. Number one cause of stroke, heart attack, high cholesterol, high lipids, all these things that are caused from diabetes, uncontrolled for years, okay? So you really want to know, am I a pre-diabetic, okay? The number one reason you should think that way, if you are 15 to 20 pounds overweight, guess what? You need to be checked, okay? Keep that in mind. All right, I want to talk a little bit about the wound center that started here. This is another step, what's going on with the clinical problems of diabetes. How many people know somebody that's had an amputation of a toe or a foot or a leg because of diabetes? Diabetes? Okay. We are now finding all these people are coming in with problems with ulcers that don't heal. I mean, they don't heal. You don't feel them often. They're just there and they drain in the shoes. People will pack them. They do nothing about it because it doesn't hurt or it doesn't bother them or they think it'll heal up eventually. Well, now we're finding out that those ulcers that don't heal get deeper and they affect the bone. And if the infection gets in the bone, often we have a really hard time clearing that infection and it can end up in amputation, which we don't want. So because of the increase of diabetes and the increase of wounds associated with the diabetes, we have opened across this country something called wound centers. And what these wound centers do is they take the chronic wounds and they treat them, and they have a high success rate of getting them healed and avoid amputation. And you have the great privilege today of actually going to see the brand new one that started here in Easley in October, which is amazing that we started this wound center here. And it's all because of the need, and because actually this hospital cares, because a lot of hospitals don't invest this kind of money, which is a lot. When you go up there and see it, you'll see how much was invested, how much equipment, how much training, how much expertise is up there. So I hope you enjoy that. That's special. Now, since I'm kind of a little bit limited on my time, I wanted to ask, does anybody have any questions? Yeah. Oh, good. Ladies first?
My mother's grandpa, my great-great-granddaddy. Whenever I first seen him years ago, he had both legs took off because of sugar. Mm-hmm. All right, it's run down through my mama's generation to me. Mm-hmm. And I've got sugar. Everyone in their family had sugar. Now, how does that work? What causes that?
Well, there actually is a gene that carries the diabetic. Are you on insulin? Or
no, I'm on
pills. And your hemoglobin A1C, do you know what that is?
No, I don't. I just go and he says, get
okay. Well, it is genetically, and it doesn't have to be genetic, but there is a lot of genetic ties to type 2 and type 1 diabetes.
I just wonder if it would be on down through the generation.
Yes. 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 So you want to keep your weight down? You want to make sure you take your medicines?
Talk to my cook about that.
Okay. I do want to bring up something. You should always know your hemoglobin A1C. Hemoglobin A1C. I should make you all repeat that 3 or 4 times. That is not for anemia, even though it says hemoglobin. What that is, in 3 months, when we draw that, that is more important than a finger stick and us drawing your fasting sugar, your blood glucose level. That tells us if you're in fairly decent control. It used to be, we used to keep it way down, say tight, tight, tight control, but we found out actually you can relax a little bit, and if you're 7 or under, that's not bad. That's not bad. If you're above 7, that's not good.
What you eat, it ain't what you eat.
Well, it's the amount and it's the proportions as you trickle in your body. Because food, whether it's this cookie or this pie or the salad, your body's like a refinery.
I can eat salad, my sugar goes high.
Could be, okay, so what you do is you refine all that and turn it into glucose, which is blood sugar, which is your gasoline. Okay, that's your gasoline.
Okay, I'm gonna look at it.
Okay, but I'm just saying everything you eat turns into it. It's just some turn in quicker than others because it's closer to being glucose, right? Like honey, sugar. Okay? So you find out from your doctor what your hemoglobin A1C. Remember, A1C. Just you need to know. And you ask him what it is. And you make sure it's 7 or less. Okay?
Okay.
Do that. Okay, I'm sorry. Next question. I think
You said overweight. I've never been overweight. There's never been any diabetes in my family, nowhere. And now I am, obviously, I take pills. I watch my sugar very carefully.
Good.
So, how come?
Well, I mean, you still have to go back to if you're a little bit overweight or if you carry extra adipose here. If you're kind of like a lean, and I'm not trying to be insulting to anybody, but our ideas of what should be here, that midriff pinch, you know, is a little bit off, you know. So you have to go back and look at your weight chart, your height and your weight. And there's the Metropolitan Life Insurance, there is a height weight.
I've always been below that.
Okay, and then you need to look if there's adipose tissue here. And if there's the fat tissue here, this here is, you know, even if you're skinny and your legs are skinny, this part is the worst place to carry it, even if it's 10 pounds, 15 pounds, okay? So now you're a diabetic, so you're taking pills. Do you mind if I ask what you take?
Oh, I don't even know what they are.
Is it real big?
No, it's a tiny, tiny little pill.
Glucotrol? Glipizide?
I have it.
Well, that's okay. That's fine. As long as you're keeping your diabetes under control, that's good. But things, good. What you want to make sure is to utilize blood glucose, sugar. The fat doesn't do much. The muscle does more. So if you have more muscle than fat, every time you move, you're going to suck up that glucose. I'm trying to do it as simple as I can. You'll pull in that glucose out of your bloodstream and use it and burn it. Fat just lays there. It's not very active. So if you can, grab one of your friends and go to water therapy and do some little exercises.
We just had a good session this morning. I go to the Y all the time.
There you go. That's the best thing. Make sure you eat small, frequent portions, not big meals. And check your glucose after you eat. Because again, I allude to the fasting blood sugar is not the best. Okay? Yes, ma'am.
Why do doctors routinely order an FBS if it's not that important?
That's an excellent question. They check in your cholesterol.
Well, they
But-
don't even check that.
I guess that it's routine to go in fasting to check things, and you're right. I'd ask my doctor. But then again, it's kind of hard to do because we should be checking after meals, but it's hard to code that and deal with the insurance companies. But I think everyone after a turkey dinner should check their blood glucose level at least once. I tell people,
What is normal then if it's not FBS? What's the normal?
you would want it less than 110. That's some people get to 120, but you want less than 120.
After you eat a piece of pie, it
You should be down 120, 110. Yeah, and it might go up a little bit as you age, but it should not. It should not go to 150, 160. It should be less than that. So if you have a friend that has a glucometer, eat a meal, have them stick your finger, write it down, take it to your doctor, and get the 2-hour glucose tolerance test like I was telling you about instead of a fasting. And that's why I keep telling you we miss diabetes for 10 years because they come in fasting, right? So we never see their after prandial eating glucose levels. And that's what we need to do. We need to check those.
Thank you.
You are welcome. Do you have a question?
No, good. Thank
No?
When they check it over a 6-month period, you know,
Your hemoglobin A1C? Yeah.
is that a accurate check?
Over 6 months it's you know, standard would be every 3 months, but insurance are getting to stretch it out more. If someone comes into me and has a hemoglobin A1C that's excellent, like 6, 6.2, 6.5, I can stretch it out. But if they're up to 11 or 8 or whatever, I don't like that because I know they're not in control and I should be adjusting their medicines to try to bring it down. And they all say, I'll do better next time, I'll go on a diet. And I went, no, you don't understand. We'll do the medicines. You go on the diet, I'll stop the medicines. But my job is to bring it down, not let it keep high and give them another second chance. I figure they already kind of had the chance. So I bring it down, and then if they do lose the weight, then I'll knock off the medicines. But I prefer to bring it down first. And if they do lose the weight or do the right thing, then yeah, I can stop the medicines. But to let somebody run high, it's not a good idea. Because then they end up at the wound care center, they end up with ulcers, they end up sick. Because one thing about high blood glucose levels is you don't fight infection well, right? That's why you get infections in your feet that don't heal up. So you want that glucose down because it does hurt you. As long as it's running high, I tell people it's like sand in your gas tank. You really need to get that glucose down. Okay? Any other questions? Yes, ma'am.
Does eating a lot of chocolate?
It won't lead you to diabetes as long as your insulin is working okay.
Well, so eating a lot of chocolate with diabetes.
No, I said it won't lead you to that.
No. Now, it is true that if you eat a lot of sweet foods, you can become a diabetic, not because of the sweet foods, it's just that you're eating a lot of calories and you'll gain weight. I mean, you can gain a lot of calories and gain weight and become a diabetic eating grapefruit. It depends on the total caloric load, and the adipose, the fat storage that you make in the belly area is the most important thing. And so if you eat 15, 20 pounds of weight from chocolate, then yes, you could develop diabetes. If you keep it in proportion and walk and take care of yourself, you're allowed chocolate. That doesn't make you a diabetic. Okay? Yes, sir. That's all right. Take your time. Have some. Don't choke. But you're in a good place if you do.
Is there any such thing as a borderline diabetic?
Yeah. Well, okay. Borderline diabetic. You know, I know they use that term all the time. That really bothers me because that's like borderline pregnancy to me. You know, it's like you either have a problem or you don't. Okay, so if you have a problem, it's there. And that borderline diabetes makes everyone say to me when they come to see me, oh, my doctor tells me I'm really not a diabetic, I'm just borderline. Well, what did we talk about the 10 years that you aren't diagnosed? The 10 years of damage to your body by the time your doctor says, oh yeah, you're not borderline anymore, you are a diabetic. That borderline or that pre-diabetic is who I like to see. Because that 10 years that I have stops them from having a heart attack, stops them from having a stroke, stops them from having kidney failure on dialysis, stops them from blindness, stops them from wounds that don't heal, amputations. By the time that 10 years goes by, that's a lot of time for damage to occur. So to me, borderline, I would think I have diabetes. It's just not real bad yet, but it's there. And now I can do something about it. Okay? So if you're borderline diabetic, to me, you're diabetic. You're just on the beginning of the scale. But it's there. Do something about it.
So you either are or you ain't.
That's right. You're either pregnant or you're not. You know, that's right.
I got another question.
Yes, sir.
Is Nutrition Action a good magazine?
The nutrition? Yeah, you have to take it with a grain of salt. I believe in nutrition wholeheartedly. I think that's where it really starts. Your body is a fine machine that runs on what you put in it, period. You put garbage in it, you get garbage out. So I think that nutritional magazines are very good. You have to be careful of some of the publicity that says, oh, we're going to sell you this pill and it's going to fix everything. You have to be careful because number one, a lot of nutritional supplements in that do not get FDA approved, right? They're not a prescription. You buy them over the shelf and they can kind of say things like this pill will make you lose weight and over 10 pounds overnight. I mean, you have to use common sense. Being a nutritionist, you should look at your basic food groups. You should eat fruits and vegetables. You should eat whole grains. You should drink a lot of fluids. You should walk and exercise. You know, kind of like what your mother and what you grew up is good common sense. You should not eat 3 meals a day at McDonald's. You know, you should think of low fat, low cholesterol. And actually, the new way of thinking, I went to a lecture in Michigan, state. Anyway, just recently this year about obesity, and they found the specialist in obesity who has a clinic in Florida, because now we know that you can take pills, you can get gastric bypass, you can go to the bariatric clinic. All this doesn't work, obviously, because we're heavier. We're not skinnier. The bottom line is you've got to eat small, frequent meals and exercise. You know, there's no rocket scientists to this. So he said, in his lecture, we gorge. We sit down and eat huge amount of foods, and that truly we are more grazers. And if we would learn to eat smaller, frequent portions, we wouldn't have such a weight problem in this country, that we eat high calories in big meals. And he said we should graze more. That's what I took out of that lecture, because I watch, you know, we eat tremendous amount of foods at a sitting. And probably should do more small, frequent meals. And that would help weight loss. Yes, ma'am.
I recently had an eye exam, which I have once a year, and I was told that the diabetes was starting to show in my eyes. And my last A1C was 6, and it's been below that most of the time. But I was wondering, I do a lot of reading and on the computer and things, will that make a difference with my eyes?
Keeping your glucose, your hemoglobin A1C 6? All right. This is a little complicated. I wasn't going to get into this, but you can have a good hemoglobin A1C and still have high postprandial glucose levels. Okay, so like you could normally have lows all the time and then eat the big meal I was talking about, and then your sugar shoots up. That's going to cause damage to your eyes. And I wonder if maybe you need to plot some postprandials and see if you're shooting up after meals, which will cause eye damage even with the hemoglobin A1C of 6. High glucose levels stimulates insulin production in a type 2 diabetic. We're talking about type 2 here. All right, insulin and glucose both causes damage to the arteries in your body. Okay, that's why you get heart and stroke, eye. You get what's called changes in the eye, and he's looking particularly at the vessels behind your eye, the blood vessels that are getting damaged. So I wonder if your postprandials, post-after prandial eating, are spiking. So maybe you need to start checking 2 hours after you eat and see if that's happening, because that's very well could be happening and causing eye damage.
So the reading wouldn't affect it at all?
The what now?
If I'm reading or on the computer?
No, that has nothing to do with it. Nothing. You're talking about diabetic eye changes? No, nothing. You're not doing anything.
Let me ask you something now. You was talking about your sugar going up when you eat. It's probably going to go up some.
It will go
How
up some.
high can it go before it starts damaging your parts?
Well,
When it comes
then
to
we
that.
really don't know the answer to that question because we don't monitor people 24 hours 7, but they say consistently 140, 150, they see inflammatory changes in the blood
I read a
vessels.
little old book up there where I used to work. And it said once it hits 240.
Oh, that's definite. There's no doubt about 240. Yes, because it actually, in the eye especially, it draws fluid in the eye, and that's why you get that blurry vision from
If it
the...
don't stay up there very long, though, it wouldn't.
Well, we can't, like for her, for instance, her postprandials may be causing the eye damage, and we don't know that. It's very difficult to do studies on a 24-hour monitoring and see the damage. We aren't quite that good yet. Someday we will. But tell everybody, I want your blood glucose levels under 140 at all times. That's kind of my basic way of saying it. After meals, if it goes up above 140, you need to cut back on your calories, take a walk. We need to adjust your medicine. Okay?
What about taking extra medicine to keep your sugar down? Like
Well,
eat a big meal and
what kind of extra medicine, though? It depends. You know, glucotrol takes days. Metformin doesn't work right away. Now, insulin, like if you do a fast-acting, like Humalog or Novolog, and you can carb count. In fact, I put a little carb counting book back there. You could figure out what you're going to eat and take some insulin and bring your glucose down within, 15 minutes actually with the insulin you take. But taking an extra pill, it's not going to work that day. So it just doesn't work that fast. The only thing that works that fast is truly fast-acting insulin. Lantus won't do it.
okay to do that?
Well, no, you have to talk to your doctor now. Don't pick you up off the floor.
I don't like it. I was just
Well, I have patients I do that with. I mean, I have patients that are long-distance runners, and we have to adjust their insulin all the time. We have to do things. They carb stoke before they do the marathon man thing, which I would never do. I'd die. But they'll do that, and they have to carb count every carb, and they have to take insulin based on what they're loading to be able to finish the race. But I do that. It's tricky. But I mean, I would never tell anybody just take an extra pill because your sugar's high. No, don't do that. Because the next day when that pill kicks in, their sugar may be low. And then they're like on the floor. Yes, sir.
When I get up in the morning, mine's about 105.
That's very good. But that's fasting.
Then by bedtime, it's like 170.
Okay.
But whether it's 105, 170, I'm on 2 pills, one in the morning and one in the evening. I should continue to take those 2 pills.
No, your sugar's not controlled. If it's 170 before bed, you need to add something either, I don't know, what pills are you on, if you don't mind me asking? If you don't want to tell me, you don't have to.
No, it's what did you say?
Metformin, okay, it's not controlling you. Are you on 1,000 milligrams?
I believe that's what it is.
Okay, you're not in control.
Yeah.
It's too high in the evening.
Well, I need to tell Dr. Henry when I come up with that because
Oh, he's wonderful. You tell him Dr. Repik said he's not in control.
Oh, right.
Oh, you can tell him anyway.
Yeah.
But yes, that's true. Your postprandial, and if you tell him that word, say, Dr. Boatwright, my postprandial blood glucose levels are too high. He'll go, wow, well, we better do something about it.
Yeah.
But yeah, they're too high. Metformin's not working, but I would not stop the metformin. That's a wonderful drug.
Yeah.
You know what metformin does?
No, I have no idea.
Okay, metformin makes you utilize the insulin you're making better. Okay, it makes it better. So as you're producing insulin, because type 2 diabetics, right? Remember I told you they produce insulin just fine, there's sometimes too much, but they're not utilizing it. So metformin stimulates your body to utilize it better. So metformin is a very, very good drug for you. It's just you probably need something else on top of it. Okay? Maybe another pill like glucotrol, or I don't know what you would need, but you need to talk to him.
I just wondered about it being
It's too high.
like this to me still taking my medication.
Right, it's too high. Regardless of your hemoglobin A1C, we talked about the postprandials. This lady will tell you, mine are real good, but I still have eye problems. Her postprandials, did you hear what he said? So probably that's what's causing it. And you need to make sure that those are down. That's,
Problems too.
well, you need to adjust your medicine. That's not hard to do. Yes, sir.
I have one more question.
Yes, sir.
Everybody tells me that I can tell that my sugar drops or I get high. Now mine can go 220, 300, or drop down to 95. I cannot tell.
No, you can't tell the difference.
I mean, people tell me, oh, I'm telling my sugar high. I can't tell where my
You know, are you a betting man? He knows where I'm going with this. Get out your glucometers and say, what's your blood glucose? Here's $1. I shouldn't do that. This is a Baptist hospital. But anyway, I mean, you know, say what's your blood sugar when it's low, and then stick your finger and see how close they are, but they're not even close. Because I've done that in my office. I haven't bet money.
I mean, I can't tell whenever it's high.
No, most people can't.
I can't go really be 325. I mean, I feel just like I do right now. It got down and get down to 95. I feel like I do right now. I can't tell the difference.
Most people can't. Because over the years, I've been checking blood glucose levels, and I'll ask them, they'll say, my sugar's perfect. And I go, what do you think it is? And then I write it down in their chart. And then when they come back, I said, you know, that sugar you thought was 100 was 280. You know, so no, most people can't. A few are really sensitive because they keep tight control and they don't fluctuate much, but most people, no.
One time I felt bad and I told my wife, I got to check my sugar. It was down to about 80. I mean, I felt woozy.
Yeah.
And that's the only time it's ever happened.
Yeah, the lows you actually feel more than the highs. Most people don't like the lows because they get shaky, they get sweaty, and you can really feel a low. Most people don't like the lows. The highs are fine, they're 200, and that's causing all the damage, like your eyes, your feet, you know, everything, but they don't seem to mind those. The lows they don't like.
What is normal?
Well, you know, I tell people, okay, your glucometers can be 100 off. Do you know that? The manufacturer okays it to be like, if it says 80, it can be 180, and that's okay. Because remember, it's a finger stick, right? It's not that accurate. It's as best we have. So you have to, what I do is sometimes I'll have people bring their machines and have them check themselves while I draw the blood and kind of get an idea where the glucometer is. That helps.
Mine's getting around about
170? That's a little high.
Yeah, well, I know it is, but that's what it's getting low.
I don't even want to know who your doctor is. I got both right in trouble here.
Moving right along.
Yeah, moving right along. Any other questions? Yes, sir.
I got one that's off the subject.
Uh-oh.
You've been from Michigan, you may answer. I've always wondered if a Wolverine was nice, make a nice house bed.
Well, I don't like U of M, so I would not have a Wolverine in my house. But go State. Yeah, a little bit. No, they're not nice house pets.
I know.
I am a Clemson fan. Both my children are at Clemson, so let's just hear for Clemson. Any other questions? All right, any more? About medicines. I do want to say a couple other things. I never run out of things to say. I put this together because I was thinking, you know, I've been doing diabetic lectures for a long time, and I really enjoy it. You're wonderful people. And, you know, this is something you've got to live with forever. Okay? Even if you lost the weight and became a diabetic, it's back in the background all the time. Okay? So I want to talk about Christmas, of course, even though Obama says, what are we supposed to say, holiday seasons or something, but Merry Christmas. You're welcome. This is, I consider the Christmas time the season of birth, the birth of Jesus. And to me, it's like a birth of people because we give, we care, we look at ways to help others. I mean, it's too bad we're not like this all year round, and I know some people are. So I'm looking at it as, for all of you, the season of rebirth is you, okay? You, your health, your body, your family, your wife, your husband, whoever. This is a season of rebirth for us. I broke it down, I was just thinking about this, into two little things. One is our spiritual birth. No matter what you believe in, all of us have a feeling of spiritual being in us. No matter what religion or anything you are, there's a spirit in us. And the other one's physical, okay? So if you look at rebirth, I look at the spiritual and the physical as being one, which is us, who you are as an individual. So if you take that, that's very powerful. Doesn't that sound incredibly powerful? Like you're really strong, you're gifted, and you're real powerful. I want you to take that and utilize that to make you healthier. I want your New Year's resolution to be one, how am I going to be healthier? How am I going to bankrupt Easley Hospital where I no longer have to come here for any lab tests? You know, I'm kidding, but you know, how can you make your health better so you have a better life? Feel better. Because high blood glucose levels and taking poor care of yourselves causes you to be depressed, right? Loss of control, feeling bad, running poorly, not wanting to get out of bed, depression. You lose energy. I mean, you're weak, you're just not strong. So your body and mind needs to have this to be strong. So I would really like everybody to work harder on their health, for me, and for you, and for your family. And I also challenge you to look at your children and look at your grandchildren and teach them to take better care of their bodies and their minds. Because I think we're letting them down. Our mothers would never let us do what we do today, right?
Right.
No good. Oh, no way. And I want to also let you know, my mom is 93 and my dad's 89, and they eat fish, they exercise. I mean, they're old. I mean, they really have their problems too, like everybody else. But they work on lowering their cholesterol, they take care of themselves, and that's why they're 83 and 89. I mean, they're trying to take care of themselves. So I want you to really work on this. You know, really think about it. And you on the computer, get on the computer and look at the American Diabetic Association, the American Heart Association. There's all kinds of new recipes. There's all kinds of ways to do this. And I want you to teach your children and your grandchildren especially, so our epidemic of obesity doesn't keep doing this. So I see 12-year-olds with diabetes because they're obese. It's horrible, and high blood pressure and high cholesterol. How long are they going to live? Let's start getting our country healthy. And it's up to us. And yes, sir.
Yeah, reason why your mother and them lived a good life. Whenever
Yeah,
they
they
were born and raised, they raised their own food.
Exactly.
It's like mine.
And they eat right.
There wasn't no hamburger joints around, no hot dog
Oh, Lord.
joints.
I didn't ever go to McDonald's. I can't stand McDonald's.
We raised our own cows, horses, I mean, we had everything.
And what were you doing when you were doing that? Inside watching TV or outside working?
I was in the field working.
Riding bikes all day, running around? I'm going to wrap it up. Do we have any more questions?
Yeah, you spoiled my new year.
Hey, you won't spoil mine if you do the right thing. I'd be happy.
Try, and thank you.
You know, and one thing is to me is we always have a challenge to do better in life, right? No matter where you're at right now, no matter what you're doing, you could always do something better. Isn't that kind of neat? Not worse, better. You'll probably love New Year's. You'll probably become the greatest chef you ever saw.
Thank you, Doctor.
Thank you. It's always a pleasure.